Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Oxygen flush. Oxygen flush is present at 35 liters per minute at 45 to 50 pound square inch. Oxygen flush is a part of intermediate pressure system. Oxygen flush is a part of intermediate pressure system, but this oxygen flush, which is a part of intermediate pressure system, is actually present in low pressure system. In oxygen flush, actually oxygen flow control valve and nitrous oxide flow control valve are low pressure systems. The control valves, oxygen flow control valve and the nitrous oxide flow control valve, are low pressure systems. So emergency oxygen flush is also present in low pressure systems, but it is a part of intermediate pressure system. So this emergency oxygen flush, once you press the emergency oxygen flush, it releases 35 liters of oxygen at 45 to 50, or in some books it is given 55 to 60 psi pressure. So this is intermediate pressure. So it releases the oxygen at intermediate pressure system. And the maximum oxygen that is released by emergency oxygen flush is 35 liters, and maximum oxygen is released at a pressure of 55 to 60 psi or 45 to 50 psi. Then this emergency oxygen flush mainly works in the case of bronchospasm or laryngospasm. Then through the normal common gas outlet, the oxygen is released at a pressure of 15 liters. Oxygen is released at a volume of 15 liters at 10 to 50 psi pressure. Whereas at emergency oxygen flush, this will release a 35 liters of oxygen at a pressure of 55 to 60 psi. This is the difference.
thank you and thank you for watching.